So hi everyone, my name's Alex and I'm a registered dietitian here to talk to you today about general nutrition and multiple myeloma. I really want this to be as useful for you and as valuable as it can be for you, so feel free to ask me any questions as we go through the presentation, and I'll be sure to leave time for questions at the end of the presentation as well. Come on in, don't be shy. So a little outline of what I'll be talking about today. So first I'll give you a little bit of an introduction about me. We'll talk a little bit about the difference between a dietitian and a nutritionist, as I know that can be a point of confusion for a lot of people. We'll talk about why nutrition is so important, some of the common nutrition-related complications in multiple myeloma, nutrition during treatment, nutrition after treatment, and then, like I said, I'll leave some space for questions at the end. Yeah, so I'm a registered dietitian. I'm registered with the College of Dietitians of British Columbia. I currently practice as a clinical dietitian with Fraser Health in the province. I also completed my internship with Vancouver Coastal Health, and I spent quite a few weeks on the bone marrow transplant unit at Vancouver General Hospital, which some of you may be aware of. And I've currently am accepting new private clients with my private practice Vancouver dietitians. And what some people don't realize is that many of extended health benefits either partially or fully cover the cost of seeing a registered dietitian. So what is a dietitian? All dietitians are nutritionists, but not all nutritionists are dietitians. So dietitian is a legally protected term in Canada, similar to nurse or physician. We have to complete a science-based university degree, including 10 months worth of practicum. We have to write a national registration exam, and then we are required to be regulated by provincial colleges, including having regular criminal record checks, and we're required by law to keep our knowledge and skills up to date. Nutritionist is not a legally protected term in Canada. Some may choose to call themselves a certified or registered nutritionist, but these terms are also not protected in BC, so really anyone can call themselves a nutritionist. So why is nutrition so important? So many people with cancer can become malnourished. Malnutrition is the result of long-term undernutrition, either of calories or protein, or micronutrients. Malnutrition is associated with an increased risk of complications such as infection, increased risk of hospital admission, increased length of hospital stay, delays in cancer treatment, poor quality of life, impaired function, and an increased risk of morbidity and mortality. So adequate nutrition can prevent delays in treatment as well as prevent hospitalization. So some of the nutrition-related complications with multiple myeloma. So the first one is anemia. So basically a reduced red blood cell count or hemoglobin. Some of the common signs and symptoms of anemia, so fatigue or drowsiness, pale skin, dizziness, shortness of breath, difficulty concentrating, headaches, cramps, insomnia, the list kind of goes on. More often than not, anemia is caused by the disease itself. This is not related to nutrition. If it is related to a nutrition deficiency, then it might be due to inadequate iron, vitamin B12, or folate. And you always want to discuss with your physician or your dietitian about testing for these deficiencies before you treat them or supplement. I would never recommend someone to take a supplement without first making sure that you rule out all the other potential causes. Many patients with multiple myeloma will require blood transfusions, and this can increase your risk for iron overload or too much iron in the blood. So it's really important you tell your physician about any supplements that you're taking, particularly iron supplements, including multivitamins that might have iron in them. Am I going too fast? Okay. So another nutrition-related complication would be bone density loss or bone pain. So to keep your bone density, keep your bones healthy and strong, we want to make sure that you're getting enough calcium, vitamin D, magnesium, and vitamin K. So some of the common food sources of calcium in your diet, the sort of most obvious one are your dairy products, so milk, cheese, yogurt. But you can also get calcium fortified beverages like soy, almond, or rice milk. Canned fish if it's with the bones, so like canned salmon or sardines, those types of things. White or navy beans, dark leafy greens, so like bok choy is really high in calcium, almonds or almond butter, and sesame seeds or tahini. For vitamin D, there aren't as many food sources, but it would be your fatty or your oily fishes, so like salmon, mackerel, herring. Also the yolks in eggs, which you are totally allowed to eat. Egg yolks have gotten a bad rep recently, but they're very nutritious. I would include them in your diet. And then vitamin D is also added into cow's milk and soy milk in Canada. So you can also make vitamin D in your skin from the sun, but obviously we all want to make sure we're wearing sunscreen when we go outside. And as soon as you put sunscreen on, the vitamin D production stops. On top of that, where we live in Canada, basically it has to do with our location and the angle to the sun and all this stuff that I barely understand, but we just aren't able to make enough from the sun. So most people could benefit from a vitamin D supplement in Canada. That's something I would encourage you to discuss with your physician or your dietitian. The other two micronutrients important for bone health would be magnesium. So again, dark leafy greens, they're in everything. Your dairy products, whole grains, legumes, nuts and seeds, and fish. And then the last one you want to be aware of are your vitamin K sources. Again, dark leafy greens, they're in every category almost. Broccoli, cabbage, kiwi, interestingly enough, rhubarb, avocado, blueberries. So basically, if you eat your fruits and vegetables in a varied diet, you're likely to get enough. Calcium and vitamin D, you want to be a little bit extra aware of. So there's kind of two sides to maintaining bone density. One is making sure you're getting enough of these nutrients, but the other one is making sure that you're enjoying weight-bearing exercise every day. So weight-bearing exercise is anything that's going to be putting like strain or pressure on your bones to help make them more dense. So if mobility is of concern for you, I would encourage you to discuss this with your physician or a physiotherapist, and they can work with you to find some exercises that are safe for you to enjoy. You may also be prescribed medication to maintain your bone density or calcium and vitamin D supplements. So make sure you talk to your doctor or your dietitian about those. And the other thing that you want to avoid for general health, but also specifically for bone density, is smoking and alcohol consumption.
How does alcohol consumption interfere with bone density?
So the question was, how does alcohol consumption interfere with bone density? And it's a very complicated answer. I'd be happy to explain it to you after the presentation. So the next one is hypercalcemia. So that's basically too much calcium in the blood. You do not need to restrict the amount of calcium that you're getting from food alone, but you want to make sure that you're telling your physician about any supplements that you might be using, so calcium supplements, vitamin D supplements, or any antacids. For example, Tums is a calcium-based antacid. So make sure you're telling your doctor about any of those. And then you want to make sure that you're adequately hydrated, drinking enough fluids throughout the day. So the other thing that we want to do is we want to protect your kidneys. So aiming for a healthy, well-balanced diet. It's a very general term, so we're going to define that later in my presentation about what that actually looks like. You want to make sure you're staying adequately hydrated, making sure you're flushing out your kidneys with fluid. And then you want to limit the amount of sodium or salt that you have in your diet. So avoid adding salt or seasonings which are high in salt to your food. Avoid salted snack foods, so like your chips, pretzels, salted nuts, those types of things. Avoid cured meats or deli meats and pickled foods. Avoiding processed or convenience foods. And avoiding canned foods unless they're labeled low salt or low sodium. You can also get rid of some of the sodium in canned foods by rinsing. For example, if you get canned beans, if you rinse them, you will be rinsing some of the sodium away. And it's not that as soon as you cut out salt, all your food has to taste awful. Your taste buds do adjust, and they will change when you start adding less salt to your food. You can season your food with stuff like herbs, seasonings, lemon juice, lime juice. If you're having kidney problems, discuss with your physician or your dietitian about your protein needs, as it might change a little bit. So another complication could be hyperglycemia. So this is basically high blood sugars or high levels of glucose in your blood. It's usually a side effect of medication, particularly steroids like dexamethasone. So ways that you can help prevent this, or if you've been told that you have this, are to achieve or maintain a healthy body weight. Making sure you're eating regularly during the day. So having your 3 meals per day. If your meals are going to be more than a few hours apart, then you could benefit from incorporating a healthy snack. You want to limit the amount of added sugars in your diet or sweets, so like pop, desserts, candies, jam, honey, those types of things. And then choosing more of your high fiber carbohydrate sources rather than refined carbohydrates. So basically choosing whole grains over refined grains. For example, multigrain bread over white bread. Or choosing high fiber cereals over like a sugary cereal. Consuming more legumes, so like beans, peas, lentils, your pulses. Choosing brown rice over white rice, quinoa, barley, oats, spelt, any of those ancient grains are going to be very high in fiber. And then consuming lots of vegetables and fruit. If you're thirsty, choose plain water. And then also enjoying daily physical activity can help to manage your blood sugars. Yeah.
I've heard theories on sugar and cancer. Or people said I've had my last apple forever, can't touch anything like that. And then there's another school of thought coming from the medical community that says that's garbage. There's no problem with sugar. Which is it?
So the question is about the relationship with sugar and cancer. So does sugar feed cancer? Should we be avoiding sugar in the diet? I'm going to go back to here. So basically, we just don't know enough yet about that. Tumor cells do feed on glucose or sugar, but it's just not that simple. The sugar you eat and your glucose in your body, it's not that simple. So we need carbohydrates to survive. Your other cells in your body also rely on glucose to thrive and survive, including your muscles, organs, brain. And even if you don't eat carbohydrates, your body, your liver is able to produce glucose or sugar. So for example, you don't eat overnight when you're sleeping, but your liver releases an amount of sugar overnight to keep you going. So it's just not that simple in terms of what you get from your diet and how it relates to cancer. But what we do know is high sugar diets, so those added sugars, so like in this slide, so like your pops, your desserts, candies, jam, honey, those aren't going to be good for you and for your disease. But choosing your complex carbohydrates meaning higher in fiber, less refined. So for example, the whole grain breads, legumes, those types of things, are still a part of a healthy diet, and I would still encourage you to include those foods. So if you're having dessert once in a while, that's okay. It's more than okay. But if it's, if you're a regular pop drinker, or you're having lots of fruit juice during the day, that might be something you want to consider kind of cutting back on or moderating. Does that answer your question? Any other questions about that? We know that these foods, like your whole grains, legumes, vegetables, and fruit, really reduce your risk for chronic disease like cancer, and so they're just they're definitely a part of a healthy diet. I would never want anyone to cut down on them. So nutrition during treatment. So our goals for nutrition, so manage possible side effects of the treatment that you're undergoing, maintaining your body weight, particularly your muscle mass, ensuring adequate protein intake, ensuring adequate fluid intake, and we want to maintain your physical function, your ability to go about your day. So one of the first side effects that many people report is decreased appetite or poor appetite. So I would encourage you to eat often. So like instead of having the 3 meals per day, try having just a small meal or a snack every 2 hours. Make every mouthful count by choosing high calorie or high protein foods. So don't fill up on the sort of empty foods, choosing foods that, so your sources of protein, obviously your meats, poultry, fish, eggs, tofu, legumes, nuts and seeds, and choosing high calorie foods, so like avocados, nuts and seeds, nut butters, vegetable oils, those types of foods. You can drink fluids which are higher in calories and protein, such as cow's milk, soy milk. You can make homemade smoothies, or you can try commercial nutrition supplements, so like Boost and Ensure are the main brands, but there's so many out on the market nowadays. And then take advantage of the good days or the good times. So if you know in the morning you're really not hungry, but by the time you reach the end of your day, that's when your appetite is the best, then really make the most of your appetite when you have it, or on the days where you're feeling a little bit better. Yep.
When I was doing my stem cell treatment, people suggest I take Ensure because nausea was terrible. Just didn't eat for days and days. RBO. When I looked at the label on that, I wouldn't.
Yeah, so, yeah.
It's got the sugar, first of all, first of all, we need whatever. It doesn't make sense to me. It's not organic for starters, so it's not away from my body. I can't help it. I can choose, but I want to make sure it's organic and it doesn't have anything else in it that I don't want.
Mm-hmm. So the question is about sort of how to get enough calories and protein without relying on things like Boost and Ensure that might have ingredients in it you don't want to have. So one of the easiest ways would be to make your own smoothies or your own milkshakes at home using real food. I always like to encourage people to choose whole, real foods first before relying on Boost or Ensure. But if you're absolutely doggone tired and you can't be bothered to make a smoothie and Ensure is the easiest thing for you to grab, I would rather you be nourished on something like Ensure than undernourished and not eating. But yeah, you can make really high protein, high calorie smoothies. You can add in to your smoothies like Greek yogurt, high-fat Greek yogurt, nut butters. You can add in silken or soft tofu to add some protein into your smoothies. I actually have a really good smoothie recipe handbook. So if you want, my email will be at the end, or I have my business cards with me. If you would like that, I can send it to you. Yep. So the question is, what happens when you're so nauseous on some days you really can't eat, but then on other days you feel better, so you're eating a lot? So I do have a slide about nausea and ways to help manage that, so we will be discussing that. Honestly, just do what you can. So if you really can't eat on those days, but on 3 days later you feel great, really try to maximize what you're getting in terms of calories and protein. No, it's not ideal, but what can you do, right? Yeah. Yeah, So the question was about all of the powders that are available on the market today, like your veggie powders, your protein powders, those types of supplements, if they're really something that you should be including, or if it would be better to have the whole food like the kale or the spinach, those types of things. So again, reiterating, my preference as a dietitian is whole, real foods first. So if you can do it by consuming your vegetables, your fruit, your whole foods, I think that's preferable. Those foods, your body naturally wants to work on and digest those foods. There's a reason why we have a digestive tract. There's a reason why we have teeth to chew, and there's a reason why our stomach has acid to break stuff down. So I think it's better to consume things in their whole form than in a powdered form. They're also very expensive. And then the last thing that I want to point out, interestingly enough, there's a project that just completed a big review in the States, but also a lot of those American products are up here on our Canadian market, is the Clean Label Project, they called it. And they looked at protein powders specifically, and they found some interesting things in those protein powders that you wouldn't want. So for example, BPA, heavy metals, mercury, lead, those types of things. The market for nutrition supplements is not very well regulated. So it concerns me that we don't actually know what's in these powders, and people are consuming them every day. So I would encourage you to do whole foods first, or go on to that Clean Label Project and look at which ones are safer or cleaner. Interestingly enough, the organic products had 2 times more of the heavy metals than the non-organic products. Yeah. Or reach out to a dietitian. Hopefully we can point you in the right direction if you do want to include those things in your diet. Any other questions? Okay. So we also want to make sure that you're staying adequately hydrated. So consuming fluids throughout the day, make sure you have a water bottle with you. Limit the amount of caffeine and alcohol that you drink. Those can be natural diuretics or causing you to urinate more and become dehydrated. Try drinking most of your fluids between your meals rather than with your meals. If you already have a poor appetite, you don't want to be filling up on water when you should be having like breakfast, for example. So another side effect that you may experience is diarrhea. So this might be related to chemotherapy treatments. So the first thing to remember is to stay adequately hydrated. So if you're losing a lot of fluid through diarrhea, you want to make sure you're replacing it. You might want to try a low fiber or a bland diet. So choosing more of the refined things like white breads and pastas, white rice, your protein sources. Removing the skins, the seeds, and the membranes from fruit and vegetables. Limiting things like corn, broccoli, beans, green leafy vegetables, prunes, berries, dried fruit. These are really high in fiber. Avoid spicy, deep fried, or greasy food. Some people find that dairy products make their diarrhea worse, so you might want to try eliminating those while you're experiencing the diarrhea. But I would encourage you to not continue this diet forever. So once your symptoms start to resolve, then you can reintroduce these foods back into your diet. You also want to avoid caffeine, alcohol, and sugary foods or drinks, as these can often exacerbate diarrhea. The other thing that might be helpful is peppermint tea or peppermint oil. Peppermint is very relaxing to the bowel. So if your bowel is really overactive, you're getting cramping, bloating, pain, this can help to relax the muscles in your bowel. On the flip side, some people may become constipated. Constipation is likely due to any pain medications that you might be taking, or it might be a sign that you're becoming dehydrated. So step number 1, increase the amount of fluids that you drink. And then also try to increase the amount of fiber. So there's 2 types of fiber to keep in mind. There's soluble fiber. This is the type of fiber that mixes with water and forms almost like a gel. So it helps to keep your stools nice and soft. And then there's insoluble fiber. So this is the fiber that kind of goes through the system, basically undigested, doesn't really mix well with anything. It's really good at pushing things through your system. So you need both when you're feeling constipated. So including more of your vegetables, fruit, whole grains, so like your oats, barley, brown rice, multigrain bread, and your legumes or pulses, so your beans, peas, lentils. There's also foods which have natural laxative properties. So the most famous would be your prunes or your prune juice. Papayas, pears, apples, senna tea. You can include those. Warm or hot liquids might help you to have a bowel movement. You can try going for a short walk or stretching after a meal. But also give yourself adequate opportunity to have a bowel movement. It's really hard to have one if you're trying to rush between places. And then the other thing that can help is your positioning. So human beings weren't designed to go on a toilet. We were designed to squat. So make sure your knees are above your hips on the toilet by using a stool or a box under your feet. So then we come to nausea. So the big one when managing nausea that I really want to stress to you is make sure you take your antiemetics as prescribed. Don't wait for the nausea to hit you. Take them, if you've been prescribed ondansetron or something like that every 8 hours, take it every 8 hours, okay, to stay on top of those medications. You could try having some dry cereal or crackers at your bedside to nibble on. Give your stomach something to settle it before you even get out of bed. Rinse your mouth out with baking soda and water throughout the day or after vomiting. You can try ginger. So ginger is a natural antiemetic or anti-nausant. So you can nibble on some crystallized ginger or pickled ginger or make a tea with some ginger. Try again to have your fluids between meals instead of with meals. Try small, frequent meals. So sometimes just allowing your stomach to become empty can create that nauseous feeling, so snacking frequently throughout the day can help. Try bland, cold, or room temperature foods. So really some people might even find keeping a journal to identify when their symptoms happen and some of the triggers. So it might be the smell of food. So you get your plate of food and that odor causes the nausea. So room temperature or cold food that's less likely to have that smell could help. It could just be feeling stressed or fatigued. So taking time for adequate rest can help with your nausea. Making sure you eat in a relaxed environment, get fresh air, take time with your activities. If you can, ask family or friends to cook or have meals delivered. And then make sure you wear loose-fitting clothing so you're not getting any pressure around your stomach. Any questions about that? Right. So the comment was including acupuncture, acupressure as part of nausea control. Seeing an acupuncturist or looking up those pressure points can be really helpful to nausea. I can't speak to that, so I trust your experience. So the next thing might be some taste or smell changes. So rinsing your mouth out before or after meals with the baking soda and water can help with any taste changes. Practicing good oral hygiene, brushing your teeth and tongue frequently throughout the day. Experiment with food flavors and eat foods that taste good to you and avoid foods that don't taste good to you. It's okay to eat the same thing every day if that's what's working for you. If you have a metallic taste in your mouth, try eating cold or room temperature foods. Avoid cooking in metal pots and pans. Try marinating your animal proteins, chicken, fish, meat. Use plastic utensils or chopsticks instead of metal forks and knives. And try your plant-based proteins, like your legumes, nuts, and seeds. If fluids taste overly sweet to you, you can dilute them with water or add a pinch of salt to cut through that sweetness. If food tastes too salty, try lower salt or reduced salt products. You can also add a pinch of sugar to cut through the saltiness. If food tastes bland, use your condiments, herbs, seasonings, spices to really try and flavor your food. If the odors of the food are starting to affect your taste, use a fan when you're cooking. Use covered pots, crock pots, barbecues, microwaves to cook. Sit by an open window, order takeout, ask for help from your family and friends, and again, try the cold or the room temperature foods. If you have a dry mouth or a cotton mouth, try sucking on a lemon or a lime wedge before a meal to get your salivary glands producing. Try sugar-free gum or tart candies like Jolly Ranchers, anything sour to get that saliva response. Pickles, sweet and sour sauce, lemonade, anything kind of sour. Yeah. So sometimes you can get a yeast infection or thrush infection in your mouth. Yeah. Yeah, definitely. So anytime you have a yeast infection or thrush infection in your mouth, it might affect your eating. Definitely go straight to your physician and ask for treatment of a thrush infection would be my first go-to. That would be where oral hygiene really comes into play, brushing your teeth and tongue frequently throughout the day. You might need to brush it more than twice a day if you're having dry mouth because you're not having your bacteria isn't being washed away by your saliva. But yeah, I would go and get the treatment started right away. Practicing food safety. So wash your hands as often as possible. Keep your raw foods separate from your already cooked or already prepared foods. Using disposable paper towel. Always thaw and marinate meats in the refrigerator. Don't do it like my mother on the counter. Refrigerate and freeze your leftovers within an hour. Make sure all of your meat, poultry, eggs, and seafood is cooked through thoroughly. So what we're trying to do is reduce your risk of foodborne illness or foodborne infection. When you're neutropenic or immunocompromised, you want to also avoid unpasteurized, basically anything, but particularly dairy products, any of your moldy or soft ripened cheeses, unwashed fruits and vegetables, buffets, salad bars, deli counters, raw nuts, honey, sprouts, and sushi. These are all high offenders for foodborne illness. Yes?
I wash my fruit and vegetables now in a little bit of vinegar and water.
Yep. So.
Does it do any good, or is it just?
Yeah, so the question is about washing your fruit and vegetables in water and vinegar. So there are some studies that have shown that the vinegar could help to kill off some of the bacteria. I would warn you, though, that any of your soft fruits, they might spoil easier after that wash, so make sure you consume them quite quickly after that. Yes?
Generally speaking, when you don't have issues eating raw nuts, all raw nuts, are there any issues with that? Should they be boiled first or anything?
The question was eating raw nuts if you're not neutropenic. I would encourage you to get roasted nuts from the store. If you're undergoing a stem cell transplant, you will have to follow more extensive food safety, but you'll receive specific guidelines from the hospital or the clinic that you're admitted to. So a note about supplements, and this goes for any vitamin, mineral, herb, powder, any kind of supplement. Make sure your physician or your dietitian is aware of any and all supplements that you are taking, because some of them can have a significant effect with some of your treatments. For example, if you're taking Velocade, green tea and vitamin C can have an interaction with green tea. Avoid green tea supplements. You can have green tea, but maybe avoid it on your treatment days. Vitamin C, avoid the supplements, but there's no need to reduce the intake of fruits and vegetables in your diet. So this is what I would really like to drive home to you, is treat your food like medicine. Even when you really don't want to eat, think of it like, would I skip my medication right now? No. Would I skip my snack or meal right now? No. Even if it's a little bit, even if it's just a smoothie or something really small, it can make a big difference in your nutrition and your overall outcomes. So after treatment, so basically following a general healthy diet. So you want to maintain a healthy body weight, enjoy a physically active lifestyle, eat your whole foods and limit the processed foods, include lots of vegetables and fruit, whole grains, your plant-based proteins, your legumes, nuts and seeds, tofu. Limit the amount of red meat that you have, limit the amount of processed meat that you have. If you do eat fish, aim for 2 servings of fatty fish per week, so like your salmon, mackerel, herring, sardines, Arctic char, trout, those types of things. If you don't eat fish, talk to your dietitian if an omega-3 supplement might be right for you. Drink mostly plain water. Milk and milk alternatives, tea and coffee are all okay as well. If you drink alcohol, limit consumption. So this is the quote-unquote Eat Well plate from Health Canada. And it can be an easy way to just kind of check your breakfast, lunch, dinner. Am I consuming a healthy plate? So we want half of your plate to be covered with non-starchy vegetables. A quarter of your plate would be your protein sources, so your meat, fish, poultry, tofu, legumes, all those types of things. And then a quarter of your plate would be your starchy foods, your whole grains, multigrain bread, whole wheat pasta, brown rice, potatoes, sweet potato, those types of things. If you're still hungry after your meal, then I would encourage you to go back for a second helping of the vegetables or the fruit. So sorry that we kind of raced through that, had a little bit less time than I anticipated. This is my contact information. I also have business cards up here. If you kind of think about it when you go home, you have any other questions, please do reach out. I'm happy to answer them. And if you want to work with a dietitian, you have coverage under your benefits, then we can work together as well. Thank you. Should I take questions with the group, or?
This is one quick one.
Quickie, come on.
Okay.
Very quick one. I missed what you say, I know what to do instead of getting powdered kale, use kale. But what was your substitute for protein powder?
Okay, so the question is the substitutes for the powdered supplements, particularly protein powder. So with protein powders, eating your protein sources, first of all, so your meat, fish, poultry, dairy products, tofu, legumes. If you really are relying on a protein powder, you could choose skim milk powder. That's basically just dried milk. That will be high in protein. Or you can talk with a dietitian about particular brands. With Health Canada, you can look for a natural product number or drug identification number. I believe it's 9 digits long. It'll be on the product. And that means that Health Canada has looked at it. I don't know how rigorously they've looked at it, but that could be your first step to finding a good product.
Sorry.
No, that's okay.
Thank you very much indeed.
Thank you.
That was excellent. Really appreciate it.